Hello and welcome to Today in Geography, a podcast produced by the Department of Geography, Environment, and Spatial Sciences at Michigan State University. Each episode, we talk with members of our community about their research and interests, and then we spend some time spotlighting events and celebrations that have shaped the field of geography. I'm Nathan Moore, an associate professor in the department, and your host for an engaging exploration of people, places, and stories that shape our world. Yeah, I just got the flu. My voice is a little crackly, but hopefully you can bear with it. Today, we're marking the anniversary of the official declaration of the COVID-19 outbreak as a global pandemic by the World Health Organization on March 11th, 2020. But more about that later in our show. First, I'm joined today by Sue Grady, a health and medical geography professor in our department. Sue, thanks for joining us today.
Hi, Nathan. Thank you for having me.
Let's get to know a little bit about you and your geospatial journey. So, what were some of the forces? What's your story, like your creation story of how you got to MSU?
Okay, well, like a lot of people that come into geography, we often come in a little bit later in our life. I started out as a nurse. I worked in a surgical intensive care unit, and for about 10 years I did that, and I then did some volunteer work with the Children's Heart Fund. And myself and another nurse, there was a rheumatic heart disease outbreak down in Tegucigalpa, Honduras. So another nurse and I volunteered our time, and we went down to this hospital that was going to begin then doing some surgery on children. Rheumatic heart disease affects the valve of the heart, one of the valves of the heart. So they were going to do this procedure, but they had not done it before, replacing this valve up in the heart of these children who were infected. So we went down and we were helping to train the nurses in the post-op care of these children after their surgery. So one year I went down, maybe 3 times, again with the Children's Heart Fund. And when I would come home, I would be, up in Minneapolis, and it was kind of a high-tech hospital, I guess. We did a lot of research and open heart surgery and different support devices for the heart and things like that. So I was that year I was going between kind of a very poor hospital where there were very few resources and our hospital in Minneapolis that was, had everything. And I was trying to just kind of manage what I thought about that, because it was the first time I was really introduced to kind of poverty, really. And then over time, I decided I wanted to go and get my degree in public health, my master's in public health, and learn a little bit more about what was going on in the world outside of the hospital.
Why were these huge extremes? Where did they come from? A good geography question.
Well, yeah, in Tegucigalpa, the hospital, it was fairly poor. There were few medications that we were used to using up in Minneapolis. The kind of minimal resources. The nurses were all very good, but they had not conducted this kind of post-op care before. So it was primarily the resources that were lacking in Tegucigalpa, and then all of the resources that we had up in Minneapolis. So it opened my eyes to the fact that there were probably, many more places around the world that were just as poor, and perhaps, I could learn more about that. So
that motivated your degree in public health.
Yeah, that really motivated my degree in public health, but I had an associate degree in nursing, and I needed that bachelor's degree. So I really didn't know what I was going to do for that. So I literally went to the University of Minnesota and got their course catalog and was kind of flipping through, started at A and was working my way down, looking at all the degree programs, and I saw geography. And, I was one of these kids when my family took family trips. I'd be sitting in the back of the car with the atlas open, finding, giving my dad and mom directions. And when I saw geography, I thought, wow. And then I saw medical geography. There was a course in medical geography. So I went up to the university's geography department and met with Connie Weil, who was a medical geographer. She worked in Bolivia. Her research was on oral rehydration salts and children's diarrhea. And I walked into her office and she had maps, and I just got hooked right away. And she said, come on in, you get your bachelor's degree. So I kind of worked under her for the next 2 years. I worked the 3 to 11 shift at the hospital and took my geography classes during the day. And I got to say that was one of the hardest things I ever did, because my very first semester I took physical geography and human geography at the same time. And this was after 10 years of working in the hospital. I knew nothing outside of the hospital. And to learn so much in one semester was really intense. But I knew I was in the right place. But I would go back to work and the nurses would say, what in the world are you doing? Studying geography. So I kind of felt like I was following my dream. I really didn't know where that would take me. It just kind of felt right. And I knew then once I had that bachelor's degree, I could then apply for these Masters of Public Health programs. But having loved geography, then once I did graduate, I wasn't exactly sure if I should stay in geography or go into public health. So I applied to 3 schools in public health and 3 schools in geography. And then I got accepted, I don't remember exactly how many in both, but I decided then to go on and get the professional degree in public health. And I got the master's then in international health.
So this is the beginning of your globetrotting.
Yeah, that was the beginning of the globetrotting. Yep. While I was working on that bachelor's degree, I did an internship, a study abroad in Colombia, Bogota, Colombia, kind of went from hospital to hospital down there just to get an idea of the healthcare and how they practice down there. And then I went over to Africa and worked in Zimbabwe, Uganda. So that was kind of it opened that geography degree, and then the public health degree, of course, then really opened up for me to learn a lot more about the world and health around in different places of the world. So while I was getting that bachelor's degree, though, I was introduced to human ecology. And I love that conceptual framework or theoretical framework of thinking about people nested within their environment and the culture and their behaviors and how they kind of operated in that environment, in their physical, social environment. And that human ecology approach, I just loved it. It seemed really holistic to me in terms of understanding health. So I went home after the master's in public health degree and did some traveling in Africa. I went home to Minnesota, worked at the state health department for a little while as an epidemiologist in there, doing some surveillance work. And I don't know, I just kind of got wanting to go back into geography. So my brother lived in New York, and Hunter College, their anthropology department, the editors were the editors of the journal Human Ecology were there. And I looked them up and I thought, wouldn't it be really something to be able to go learn from them? This human ecology, the Journal of Human Ecology, learn from those editors. So I applied and got in, and I went there. I went to New York. I then got the second master's in anthropology. Geography was on the I think the seventh or the fifth floor. Geography was on the seventh floor. I went up to geography, started working with Connie Weil Sarah McLafferty on a project, And then she kind of agreed that it would be great if I did a PhD with her in geography. So, it was kind of following my dreams, really, and not exactly knowing how each of these turns in life were going to turn out, but knowing that there was something there that I thought would be good.
Like so many people we've talked to on this podcast, there's been a combination of mentorship and then these early experiences that kind of, like you said, you come to geography later in life, but it's always kind of been there. So it sounds like you've got a story that kind of fits within that broader pattern. So you came to MSU.
Well, then I got the PhD in geography. Actually, in my first year of the PhD program, geography merged with geology. So my PhD's in earth and environmental science. And there again, I found myself learning, taking these required courses in geology for the first time in my life, learning all of the rocks, learning about the earth processes. I'll never know as much climate as you do, Nathan, but that was, again, but I felt like it was meant to be, because I there then learned more about the environment. So I felt like I had the people, the nursing, the culture with my anthropology, and then the geography and the environment. So it really, even though I didn't really plan it, it really turned out nicely for me, I think. So I finished that PhD degree, and just started applying for jobs. And that's when I came to MSU. My dissertation was on segregation, racial residential segregation in New York, looking at adverse birth outcomes and trying to understand the racial disparities and why the rates of preterm birth and low birth weight were so much higher among Black women. And, we know we've known for a while that it's not because, people are more likely to smoke or it's not individual level risk factors per se. I was proposing that these disparities had more to do with the environment, and here the social environment. So my dissertation was on segregation and adverse birth outcomes, and I was thrilled to be able to come to Michigan State because our cities here in Michigan, many of them are or have been highly segregated. I was able then to move my work on segregation and adverse birth outcomes into Michigan.
Okay, I know you've done like a lot of things. Like you've worked a little bit on Romer's Law. You've worked there was an article I think you did about how gun violence is infectious. I think you were co-author on that. You've done a lot of things, but the maternal and child health seems to be like the center of most of your research. So, what are you working on these days? What are some of the preeminent projects that you've got going on now? We talked to Angie, but maybe you can mention her work and some of the things you've got going on now.
Yeah. So my primary work, I got kind of introduced with the health department when I got here. So every year, the health department provides me with their vital statistics, birth, and linked infant death records. That's been ongoing since I've come. So I try to work with those data to keep up to date in terms of spatial patterns and underlying processes of adverse birth outcomes in Michigan. But I have had a number of students over the course of my time as a faculty member here. Students come in. I don't necessarily ask them to do the research that I'm doing. I give them really the space to think about what it is that they would like to do in the field of health. Many of my students have come in with other backgrounds. they found the geography kind of similar to how I did. So they take a little bit of time and really think about what it is that they would like to do. So it appears that I have lots of different projects or lots of different interests. And a lot of that's because my students have lots of different interests, right? So they kind of follow their dreams and do different things. And I support them on that. And then I think some of the skills that we use in spatial epidemiology and medical geography, other fields appreciate those. So that's why I was asked by criminal justice to come over and look at, use the tools that we use in spatial epidemiology to study gun violence.
Oh, okay.
So thinking of gun violence as an infectious disease, or how would we model that?
So if you were to take us on a field trip to use one of these, some of these spatial epidemiological tools, if I'm using that word right, can you sort of walk us through what kind of data would you collect? What do you look for in the environment for that kind of research?
Yeah. Well, most of my work and many of my students' work, begins by utilizing secondary data sources. So we kind of come from the perspective of first we conduct surveillance. We take the data and we map it. We look at the spatial patterns. We do some cluster detection techniques where we identify unusually high areas of disease or low areas of disease. And we begin to really kind of document the spatial patterns. And then if we find that there are clusters of disease, then we can go to those places and we can go and study those clusters of disease more on the ground.
So it's like a scavenger hunt, and you don't really know what you're looking for, that you kind of have to look at everything.
Yeah, well, we can do some analyses while we're still conducting our surveillance. We think of our work first conducting surveillance, and then beginning to look at the underlying processes to explain the high patterns of disease, or the patterns of disease. And that's why geography is so rich, is because we could have a couple of areas with elevated disease, but the risk factors underlying those areas could be slightly different. There are common risk factors like smoking or, water quality, but it could be that in one area there are different risk factors than there are in another area. So we can begin to explore those underlying processes to explain the spatial patterns with the data, with the variables in the data set. Yeah, developing some hypothesis-driven models. But then we often want to then go to the place and take a look. Maybe take a field trip. We've been known to rent a vehicle or get one of MSU's vehicles for the day and drive out to the place and take a look, and begin to better understand on the ground and what might be happening there.
So that's really interesting. So how has being a geographer changed the way that you look at your surroundings and your environment?
Well, we always look at who are the people. I always say, and I say this over and over in class, they get tired of me saying it, but if you're doing a study or you're overseeing the health of the people, you have to know who they are. And when you look over the life course of people, there's children and elderly who are more susceptible than the healthy aged adults. So one of the things that we would want to learn then is about the kind of the age structure of the population. So if we go into a place, we'll start looking who lives there. Are there a lot of children out playing? Are there older people? Who are the people that are living in the area? Because that can kind of inform us of who might be more susceptible to certain diseases. And then we just kind of generally look at the culture. Are people outside? Are people...
Is it walkable?
Is it walkable? Yeah.
Are there public spaces? Yeah.
Yeah. And then we'll look at the physical environment. Are there water wells, or is it public use of public water? We'll just kind of do an assessment and really begin then to understand, again, from that human ecology perspective, people, their culture, behavior, and the environment. And the physical environment, but then also the social environment. Is this an area of high poverty or not? Or is this an area of more wealth?
Are you seeing some of these bigger trends like superimposed on your research, things like climate change or migration or urban development? Are you seeing these bigger patterns sort of trickle down and affecting your research?
Well,
Some of your research.
No, it's very important. It's a really, really important question, because I always say when we do our research, we have to know where we are when what we're studying. So again, let me just back up a little bit. When we first conduct a study, we'll look at those spatial patterns, and then we might go out to the place and perhaps we'll do some interviews. So if I'm doing a study, I need to know, right now I'm looking at the spatial patterns. Right now I'm doing my interviews. It might find that nothing comes from the interviews. So then we need to look more at some of the structures. What are the socioeconomic structures? What are the political structures? What are some of the policies or laws? So it might not have to do with the people and their behaviors. It could have more to do with bigger picture factors. But then we usually come back to look at the bigger picture factors and how people are operating within those. So for an example I use in class all the time, we have a law that we should wear seatbelts, right? It doesn't mean I have to wear a seatbelt, right? I choose to wear a seatbelt, but people operate within bigger systems or bigger structures. So whether it's climate change or whether it's unemployment rates, those are bigger picture structures, but people are trying to manage their lives within those structures. So often, we have to kind of disentangle people from the context of their environment. And that's one of the hardest things to do in terms of understanding the impacts on health. What is contributing to health? Is it the individual themselves? Is it the policies and some of the bigger structures around them?
Is it causal or just correlated?
Yeah, or often it's the interaction between both. So it does become a matter of really kind of, we call ourselves disease detectives, really going in and trying to uncover what it is that could be contributing to disease. But again, it's really important to know the lens that we're looking through to kind of answer the question, the study question. Are we looking at the spatial patterns? Are we looking through the lens of the interviews of the individuals and how they're behaving? Are we looking through the lens of the bigger picture structures? Are we looking through the lens of how people operate within those structures? So I try to compartmentalize those ways of looking at health.
I want to sort of color this with one example from one of your papers in the last 4 or 5 years. Like what's an insight that you've gotten from all these researches that you were like, oh, wow, that's not what I expected? Is there like a little particular story example that you can think of?
Good question.
Or even 10 years. I'm just throwing out time.
Yeah. Well, I think, sometimes we do bring some assumptions of what we think in terms of perhaps like if there's a cluster of disease in an area of poverty, it might not be because people are necessarily poor. It could be something else. One of the things I think about a lot in terms of people living in poverty is, what is their social capital? How are people acquiring support from their neighbors?
Boy, that's hard to measure too.
It's really hard to measure, but see, this is where sometimes you look on the map and you see an area of disease, or you see an area that's poor, and you make the assumption, the disease is because they're poor. Well, and it might not be because they're necessarily poor. It might be because there's the social capital, or the networking within that neighborhood has been breaking down for other reasons.
Is there a particular paper that you're thinking of that you looked at this? Or is it just sort of scattered through?
Yeah, I guess that's just something I think about, that we can't always just kind of jump to make assumptions. Another example, I think, too, is that, we might see an area high of disease, but could it be because the health system is weak in that area? It doesn't have to do with the people, it doesn't have to do with the environment, so to speak, but there's maybe a lack of health protection from the health system.
Like in northern Michigan,
where northern Michigan,
transport's difficult.
Yeah, and especially in the winter, transport's difficult. So understanding really, I hope I'm not jumping around too much, but trying to understand, really kind of go in with an open mind and to try to uncover the problems. We always use what's been known from the past to kind of inform what's going on now. But from a geography perspective, we're always trying to go in and really kind of uncover things that we don't know, because there's so much that we don't know still about so many different health problems.
It's all about relationships that are hard to measure, I feel like.
They are. They're very hard to measure. And that's why, we use data. We can go to the source, to the ground, and take a look. But these are things that are hard to measure. Now, I haven't myself, but some students really do a good job with that. They go and they really, really study the people and the behaviors, and they spend a lot of time just observing and becoming enculturated with the people, and they really uncover some interesting, very helpful get some really important knowledge about
behaviors and relationships.
Yeah.
If a young person is listening to this podcast and they're like, I'm interested in medical geography, like maybe they're a senior or they're looking for the next step, what kind of advice would you give someone who's interested in medical geography? Should they go try some nursing in Honduras, or should they jump straight into grad school, or what would you say?
I would say just come right into grad school. I mean, most of my students have not had any clinical training, but they will be tested on that in their comps. So we always have to get out the physiology book or the medical textbooks to really understand the disease that they're studying. So if they come and they want to do a degree in master's or a PhD in medical geography, they will get some of that clinical training.
How do they find a program that's the right fit for them?
A program in terms of
like a PhD program. Like, how did you find Hunter College, or how do other people find? Oh, go to MSU for this, and how do you find out what institutions are the right place for your particular interest?
Well, I'm big on knowing who the people are in the field. And I think, you go to a place because you want to work with a person. you like their work, you think that they would be a good mentor. So that's why I went to Hunter College to work. That's why I went to the University of Minnesota, was really to work with Connie Weil.
Great story.
I went to the PhD at Hunter to work with Sarah McLafferty.
So find people that are working on problems that are interesting.
Yeah.
And then what?
And then pick a topic that you're interested in. And knowing that it's not going to be the topic that's going to define you for your whole life, but it's going to be a great project to work on over the next couple of years, or 2 or 3 or 4 years. And just dive into it and do really well with it, and publish, and you get your name out there so others get to know you, and then you build on that. That's like the first research project.
It goes back to who are the people?
Yeah, who are the people? The people are really important, I think, because not just do they write your letters of recommendation, but the people are important in terms of formulating how you're going to practice in your life. Sarah was so helpful to me in terms of giving me the space to do the work that I wanted to do, to editing. I always say I write like Sarah. How my students are going to write like me. And just finding that where the student can really just kind of take this time in their life, whether it's 2 years or 4 years, and enjoy it, do their work, enjoy their time, so they can look back and say, boy, I really enjoyed my time during that program.
It really grew.
I really grew. Yeah, now I'm going to pass it on to others. If I work in government or if I work in a university. And I think the training that they get during their PhD, they do their research, but they also become a professional. They learn how to become a professional and go out into the world and really and do good. And that means working with other people. And that means managing projects, working with other people, and kind of making things happen. And I got to say, all my students have been really good at that.
Excellent. So clearly, who are the people is sort of a theme running through a lot of your research. But if you were to think about a more abstract idea about medical geography, or really anything in geography that we could put on a billboard, is there one concept or thing that you really feel like the world needs to know?
Well, I think that there's still a lot to learn. There's still a lot to learn, whether it's infectious disease research, whether it's chronic disease research and the different chronic diseases, or whether it's injuries and accidents or health services research. So, often we pick an area and we become very good in that area.
And you feel good about it. You beat smallpox.
Yeah. Oh, absolutely.
But there's an ocean of unknowns out there.
Yeah, but I always say our research, we move kind of step by step. Very rarely do we make huge strides, but we're persistent and we take step. As long, our findings are answering a question and moving on, answering another question and moving on. Sometimes those questions are big, sometimes they're really small, but we move forward. That's the goal of our work. But I think in terms of, on a big billboard,
well,
yeah, I would say that, the geography is so important. Again, because, trying to understand why there is disease in certain areas and not others. And again, is it the people, the environment, combination of both? Yeah, and really bringing to the forefront that how we think about disease from a spatial perspective is really important. I love epidemiologists, and they study populations, like large populations groups, which is great because then they have a big N to work with. Our N's are pretty small in geography. But to be able to really kind of oversee a map and begin to understand why there are diseases in certain places and not others is what we do. And that separates us out from others in the field of health. And I think we can contribute so much, whether it's to medicine or public health or health services research. The geographers can really contribute a lot
to integrating all
those pieces, whether it's surveillance or research.
And my last question before we do the next bit, just on a personal side, is there some place on Earth that really blew your mind, that you're like, everyone should see this? Is there some sort of like favorite place you found, or process like a migration or something that you found on Earth in your travels?
Well, I guess growing up in Minnesota, the blue sky every day and the cold weather is what I feel most comfortable in. Either the blue sky or I was born in Miami Beach, I guess. I don't know, the blue sky and the blue water, or the blue sky and the snow. Either one of them fits for me. Wow. But I do, I love the blue sky, I guess, whatever the weather is.
Great answer. Sue, thanks for sitting down and talking with us today. I know you'll be sticking around to talk about the anniversary of COVID-19 as a global pandemic. But first, let's take a moment for a word from our sponsor. Are you looking to upgrade your career or gain new, in-demand geospatial skills? With Michigan State University's OnGeo Professional Certificate Program, you can earn a certificate in geographic information systems, geospatial data analytics, and visualization, all fully online. Designed by professional geographers, OnGeo courses help you build real GIS experience using today's latest tools and technologies. New sessions start 6 times a year. No long applications or campus commute, just practical skills you can use right away. Visit ongeo.msu.edu to register and start your GIS journey today, or find the link in the show notes below to learn more. So today we're observing the official declaration of the COVID-19 outbreak as a global pandemic by the World Health Organization on March 11th, 2020. Do you remember that time?
I do. I remember it very well. I remember sitting in a seminar and one of my students, Anna, saying to me, "Did you hear about that coronavirus?" I said, "No, I didn't." She said, "Yeah, there's the coronavirus outbreak." I forget where it was exactly. But she was the first to inform me of it. So we sat around the seminar that morning talking about the potential of this coronavirus outbreak. So that was way before it, though. That was the end of fall semester, I think it was, when the first cases started to appear. March was when the World Health Organization declared the pandemic, and March is when the United States started its surveillance of COVID cases. But our first case was in, at least the study that I did was on nursing homes. When we looked back at the COVID pandemic, it was obvious pretty quick that people that were most impacted were the elderly and people with comorbidities, with other illnesses. So a few of us got a little money from the College of Social Science, and we jumped on a project to look at nursing homes. I had never studied nursing homes before, but I thought it was important. And what we realized then, that the first death in a nursing home was in early February. So by the time the surveillance data became available, all of those backlog cases popped up in March. They were in the March's database. And by the time we mapped what was given to us in March, COVID was across the country. Big epicenters in the Northeast, some in the Midwest. But in those few months, whether, it was being detected because people were being diagnosed, but to actually then see the extent of the spatial pattern, so to speak, of the COVID in that first surveillance week in early March was really amazing. That left a big impact on me because working up to that pandemic, from that morning we sat in that seminar talking about it, and then thinking about AAG coming up, does
Geography conference?
The annual geography conference. The new president at the time reached out to a number of us medical geographers to see what we thought about this. And, my response was, close it down. People are coming in from all over the world for this international geography conference out in Denver. I think it was in Denver. And, we don't know what the impact of this is going to be.
There was no mRNA vaccine yet.
No, there wasn't. There were very few supplies. So they did. I mean, not just because of what I said, but because of the group, everyone agreed. And they did. They had made the decision then to go online. But for me, that really left an impact on how quickly this virus spread across the country. And within the first 10 weeks of the pandemic, there were about 40,000 deaths in nursing homes. And which to me is mind-boggling. The numbers are so big, it's mind-boggling. So then we looked at kind of the diffusion, and you could see the north to the south diffusion. We overlaid the health and human service regions on top of the map and felt that perhaps improved communication between the north and the south, in those early epicenters, the practices that were being, the practices that were occurring in terms of moving people from the hospital into the nursing homes, which I never really understood at all, because the older people were the most vulnerable. That practice continued into the South, and it didn't have to have happened. If it became known in the North earlier in the pandemic, that understanding and practices need to be communicated before the diffusion into the South occurred. So I think that
it's interesting. I didn't think communication would have been my top concern, but now that when you describe,
I think it was all about communication, and I think
because at the time a lot of people didn't know a lot of things,
right? And looking back is great. It's really easy to look back, and we should look back. For example, the public really didn't understand why they needed to stand 6 feet from each other, in the stores and in different places. But all we had to do is show a little YouTube of a sneeze that goes about 6 feet. And that would have left an impression on everyone. So I think looking back, there's some communication, health communication, messaging that we could have improved upon. From my perspective, who am I to say, but from my perspective. But then from a management perspective, I think when that March data became available And it was mapped immediately, and we knew where the epicenters were, and we knew where those areas were that were less impacted. The communication between these regional areas could have been improved, I think, to prevent some of the practices and to promote other practices. So I think it'll be interesting over the next, couple of years to see more literature come out during those early days of the pandemic, so that we can, perhaps be prepared
For the next one.
for the next one.
I assume you teach something about all this in your epidemiology course. Is there anything else about COVID that changed, or about the way you talk about pandemics that COVID changed to your teaching style of content?
Well, I guess the whole COVID really impacted my a little bit more about my understanding of immunity, in terms of, the mandated vaccines. I thought were really amazing. We had never experienced anything like that before. But there were a lot of people with natural immunity. So, no one was talking about people receiving vaccines after they had natural immunity from having COVID. So that's something I think about, and I learn and teach more about the aspect of immunity in my courses. I spend more time on that topic of immunity in my class during the infectious disease section.
I don't know. Did you see the research that they found the furin cleavage site in Brazilian bats?
Oh no!
They found it from bats that they were sampling in 2019. This news just came out about a month or two ago. So I think that kind of kills the lab leak theory, right? Because the argument was that the furin cleavage site could only have been engineered in a lab. And so if you find it in Brazilian bats, clearly it can naturally develop.
Yeah, I don't, it becomes somewhat very controversial moving into this topic. But I felt like we should have kind of left it open and listened to everyone's ideas at the time about that. For me, it felt there were one-way conversations going on.
You were being told what to say, and that was sad. Yeah.
And we lost the
openness of science.
The openness of science. And I can understand, pandemic hits and people are dying. It's really impacting everyone's life. But I think we learned a lot from this that we really want to kind of cherish. This was an experience that we really want to, because when you look at the big pandemics of the world, this is like the fourth largest ever. And I think the students in my classes sometimes perhaps don't realize that they just lived through like the fourth largest pandemic ever in the world. And I think all of us need to kind of take a deep breath and kind of recognize that what we went through was extraordinary, and be totally open to having full conversations, whether it's about vaccination, whether it's about communication, or just having full conversations or about the origin. Let's just really discover this. And that's how we're going to do better next time, I think. But I think everyone's come through it really nicely. I'm quite amazed at the students, how resilient they are. being online for those 2 years and then coming back, and their writing skills are really good this year. I just am so impressed with how resilient our students have been. And I'm really proud of them too, what they went through. And a lot of students thought they were coming to college and then had to go back home, and take their courses from home again. So in one of my classes, I asked them to write a short paper about their COVID experiences. In the class of 120, I got to see a lot of different perspectives, and they all coped in different ways, and they all came through and did really, really well. So I think they knew that us here at MSU, that we had their backs. They felt very supported, and they carried on, and they got through it, and they're back in class, and now they're graduating. So it was an extraordinary experience.
We still have a lot to learn from it.
We do. And my hope is that we all continue to talk about it, all these different aspects that we're interested in.
Well, Sue, thanks so much for coming in today.
You're welcome. Thanks for having me. This is fun.
If folks are interested in learning more about your research, is there some place that they can go to on the internet?
You could go, I guess, to my website, and then also, I guess, to Google Scholar to look at the papers. And then I would encourage you also to go to the Health and Medical Geography Specialty Group at the Association of American Geographers. We have a really great specialty group. People from not just around the country, but from around the world participate in our specialty group. So you really can find kind of a home and a nice network of people in that specialty group.
And all the other people. Great, thank you. We'll include that information on our show notes. So that's a wrap for this episode. Thanks for listening to Today in Geography from MSU's Department of Geography, Environment, and Spatial Sciences. Be sure to subscribe and share, and join us next time as we continue exploring the people, places, and stories that shape the world around us.